administration's use of the Defense Production Act to produce more pandemic supplies in the U.S., and I was proud to be a part of the effort to secure $10 billion in the American Rescue Plan to increase the domestic supply of PPE and other medical supplies. In 2020, the U.S. was overly dependent on China, and we did not have sufficient domestic sources of very critical PPE, which was exacerbated by a shortage of raw materials. When the pandemic hit, there was a bottleneck in the global production of medical-grade melt-blown material that is essential for N95 masks. Today, Wisconsin manufacturers have the ability to provide the melt-blowns to provide surge capacity required to produce billions of N95 respirator masks. This type of American manufacturing is exactly what we need to be supporting. Ms. O'Connell, I know that ASPR has used significant funding to increase its inventory of supplies, but I'm concerned that if we don't focus some of our expenditures on raw materials, we may remain dependent on China and other countries. How is ASPR working to secure supplies of raw materials like melt-blown to make us better prepared for the future?
Senator Baldwin, thank you so much for that question, and thank you for the work that you did to get that $10 billion in the American Rescue Plan. We just recently had released by OMB $2 billion of that 10, which is going to go to, among other things, expanding manufacturing for raw materials for vaccines. So that's one of the first efforts that's going to that money will be used for. It will also go to make sure that we have enough fill-finish capacity, needles and syringes, and it's just the start. We're, of course, very anxious to get these contracts awarded and moving, but it's the beginning of that $10 billion going to exactly what you had hoped it would go to. Of course, that's not enough. We've got more to go. But I just wanted to share with you that's where we are right now. We've also spent, as I mentioned earlier, other supplemental funds on producing in the U.S. Gowns and other PPE. So we're continuing to do that domestic manufacturing, but we do have this industrial base expansion for vaccine manufacturing capacity right now.
Okay, thank you. During this committee's last COVID-19 hearing, I asked about the administration's approach to reducing waste and better targeting vaccines, including by reducing the number of doses in each vial and the number of vials in each package. Experts believe that both of these steps would significantly aid vaccination efforts, as doctors' offices and community organizations could more easily give interested patients shots without worrying about spoiling additional doses. In that hearing, Dr. Kessler expressed the administration's strong desire and effort to move forward on both of those goals. But recent reporting suggests that this might no longer be the case. Dr. Fauci, can you assure me that the administration is doing all it can to encourage the production of smaller vials and smaller batches as soon as possible? And what steps are being taken, and what is your anticipated timeline for changes like this?
Well, thank you for that question, Senator. That is not really in my area of activity. I believe that's more of an FDA question.
Dr. Woodcock, please.
Certainly, and between ASPR and FDA, right? Basically, to do that, we need to get the manufacturers to change how they're manufacturing the drug and what the storage conditions might be and things like that. And I think heroic efforts are being made to try and get vaccines that don't require deep freezing, storage conditions, and that could be then broken up into smaller groups and stored in, say, a pediatrician's office refrigerator. I mean, that's the ideal here, that so that pediatricians and others could primary care at the pharmacy, at the nursing home pharmacy, whatever. As new people come in, they could vaccinate them without wasting large amounts of vaccine or having to break into something in the deep freeze. So those efforts are arduously going on. They are highly technical, though, and they aren't simple. And I think the government and the manufacturers are both united in realizing this is necessary.
Thank you.
Thank you.
Senator Tuberville.
Thank you very much. Thank you for being here today, testifying. Dr. Walensky, you've been in your current post since January. You're in the top position, and you surely have heard critiques of the job